talking about the management of acute low back pain. So that's pain in the centre of the lower back here. I'm not talking about sciatica, which is something slightly different. This is leg pain predominantly in the absence of low back pain. We're talking about mechanical pain, pain coming from most likely muscles and joints in the lower back after doing some excessive gardening or something similar. So the first thing we want to do is to try and manage the pain. It's the muscle spasm that predominantly gives you most of your discomfort. So we want to try and relax those muscles off. Now you can use heat, you can use ice, it comes down to personal preference to a point, but get some ice or some heat on it right away, and we want to try and relax those muscles. The way I tend to do it is by lying either on the floor or on the bed, whichever you can get down to, and keeping your knees bent, which takes off all the tension on the lower back. So I'm on the floor with a couple of pillows beneath my knees, and I'm just relaxing into this position. If you lie with your legs totally straight, your back tends to hyperextend slightly, and that can increase your pain. So just relax in this position for as long as it takes for things to start to settle. That might be a few minutes, it might be an hour or so. Once things feel nice and relaxed, then you can start to encourage a little bit of active movement. Movement is a great pain reliever for low back pain. So we want to slowly bring one leg up at a time and gently rock it towards your chest. Now the movement might be minuscule to begin with. You can slowly increase the movement, but we don't want any sudden jerky movements which might exacerbate any muscle spasm. If you can, join the other leg with it. And again, very gentle, slow rocking movements like rocking a baby. Gentle, gentle, gentle. If you want, you can do a circular movement as well, or you can gently go side to side. But start with some gentle rocking to begin with, and do this regularly. Do it every few minutes, and then slowly, one at a time, relax your legs back down into that supported position. Another nice movement to do in this position is pelvic tilt. Now, pelvic tilt means to push your lower back into the floor, pulling your tummy muscles in towards your spine, and relax. It's a very small, gentle movement, but it does encourage a little bit of traction into the lower back, which is going to give you some relief of that muscle discomfort. So stay in this position as long as you can, okay, whether that's a few minutes, whether that's a couple of hours, and as long as you're doing some gentle movements in between, that might be all that it takes to calm it down. We can move on from that by getting onto all fours and adopting a tabletop position. And those of you who do your yoga regularly will be familiar with this one. We call this the cat and the cow. So it's again a gentle movement, arching the back up to the ceiling and slowly dropping your tummy down to the floor. And it's a lovely way of encouraging some very gentle spinal movements without exacerbating the lower back pain too much. And again, a little and often, a little bit of rest, a little bit of exercise. That's the key in managing acute low back pain. We don't want you to spend hours feeling that you have to walk around too much. It doesn't do any harm to relax, as long as you're doing some gentle movements like that to ease it off. Obviously, if symptoms persist longer than a week, then do go and see a health professional who can help you. Thank you for listening.